Hi, so this will be a video where I'll be discussing about all the different types of aphasias in a very short amount of time. Will be like a very quick video. So first of all, we have to talk about the kind of aphasias. Here it may look a bit complicated and a bit daunting, but I will make it easy for you. So first we will start with all the three things, which is the Broca's aphasia and the Wernicke's aphasia, along with that the conduction aphasia, right? So in Broca's aphasia, first of all, the Broca's area is the Brodmann area number 44, which is located in the inferior frontal gyrus, and Broca's area is responsible for fluency of the speech. uh, if we come to the Wernicke's area, it is located in the superior temporal gyrus, which is the Brodmann area number 22, and it is important for comprehending the speech, right? So basically whatever you hear, you get the comprehension of it from the Wernicke's area. And conduction aphasia is something which is basically the thing that is affected via the connection from the Wernicke's to the Broca's, which is the arcuate fasciculus. So the first thing that you need to know is that any one of the three, if injured, which means the Wernicke's or the Broca's or the connection between the two, which is the arcuate fasciculus over here, if any one of these is affected or injured, then repetition is lost. Okay, first thing first. Now we will have three words which will almost certainly help you in differentiating the different types of aphasias. So you will have fluency, you will have repetition, and you will have comprehension, right? So we categorize them as F, R, and C. So based on the presence or absence of individual of the three of these in an aphasia, we will be able to know what kind of aphasia is this. For example, in Wernicke's aphasia, what happens is that since the Broca's is normal, the fluency is going to be normal. And since Wernicke's is affected, and it is one of those three things which, if affected, the repetition is lost. So R, the repetition is lost, and since Wernicke's is responsible for comprehension, the C is also lost, right? So F is fluency is present, but repetition and comprehension is lost in Wernicke's aphasia. If we talk about Broca's aphasia over here, then in Broca's aphasia, comprehension will be present because Wernicke's area is normal, but there will be broken words, there will be less fluency, or it will be non-fluent, right? Because that's the basic job of Broca's area. So that is lost, and since it is one of those three things which, if lost, repetition is lost, so repetition is also lost, right? Conduction aphasia is just the problem of arcuate fasciculus, and it is one of those three things where if loss happens, then repetition is gone. So as I was saying, in conduction aphasia, since the only connection between the Wernicke's and Broca's is lost, number one thing which we'll lose is repetition, because it is one of those three things which, if lost, repetition is lost, right? I'm re-emphasizing on it again and again, right? So repetition is lost, but Broca's and Wernicke's is all right. So the fluency and comprehension of the thing is absolutely normal. Now a combination of all of these three things, where the Broca's is also affected, Wernicke's is also affected, and arcuate fasciculus is also affected in, say, some NCA stroke, then in that case you will have something called as global aphasia, where all the three things, basically fluency, repetition, and comprehension, is lost. Essentially the person is mute right now, right? Now if you have repetition present, basically now we will move on to levels where these three will be normal, right? But still we'll be having aphasias. So since these three are normal, the first thing that we definitely have is repetition is going to be present. Now we will have the sensory association area associated with the Wernicke's area, right? So the connection between the two, and if there is a problem between those two, then we will have transcortical sensory aphasia, where again it is essentially Wernicke's with repetition, presence of repetition, right? So you will have fluency because technically Broca's is normal, and you will have comprehension loss because Wernicke's is affected, right? Because the connection is lost and repetition is going to be present. And on the similar lines, the connection between the motor speech area and the Broca's area, here we will have, if there is loss, we will have transcortical motor aphasia, where essentially the Broca's area is hindered, right? So we'll have loss of fluency, but we'll have preserved repetition as well as preserved comprehension because of functional Wernicke's, right? And a very rare kind of extreme variety of transcortical aphasia will be transcortical mixed aphasia, where we'll be having only presence of repetition, whereas we'll lose fluency and comprehension. Okay. So if you have to know a few certain words and the most important things regarding aphasias, first of all, loss of repetition is the thing which separates the transcortical aphasias from those Broca's, conduction aphasias, Wernicke's aphasias, and global aphasias, right? So repetition is the first thing that we'll use for differentiating the transcortical from the non-transcortical aphasias, right? So for Broca's, what you need to know is, in Broca's aphasia, Broca's is for fluency, so we'll be having hindered fluency, right? So we'll be using broken words. People will not be able to form perfect words, and there'll be loss of fluency, they'll be very non-fluent. In Wernicke's aphasia, we'll be having loss of comprehension. So since the person is not able to comprehend, he will say anything. It may be new words, they will discover new words, and they will say that out. Basically something called as a word salad. And in conduction aphasia, there'll be loss of repetition. So if you ask them to simply repeat something and they are not able to repeat something, though they are able to understand what I'm telling, and they're also able to tell you other things which are very fluent in nature, then that is conduction aphasia. So that is all I had to say. So yeah, thank you.